Welcome to this webinar on assessing and minimising the risk of COVID-19 on your park. We don't know so much about COVID-19, but what we do know, it's not, as we first thought, a simple flu-like infection. It is in fact part of a whole family of crown-shaped viruses, hence the name corona for crown. COVID-19 is the name of the disease, and it is similar to SARS and MERS in that it's a severe respiratory infection. That means it's affecting the lungs and your breathing system. So virus, not a bacteria. That's important because not all antibacterial cleaning chemicals will kill it, although most will, but it's worth checking with your supplier. And of course, if you catch the disease, then no antibiotic which kills bacteria will treat it. More people than we first thought can be carriers of the disease, which has created new problems in that this means they could be walking around with the COVID-19 virus inside of them and shedding that virus onto surfaces and into people's breath, as we'll see. The symptoms were originally put forward as a dry cough and or a fever, and they are still the two main elements that mean somebody has COVID-19, but it's also now been linked to a loss of smell or taste. So you could have all of those symptoms. Some of the people will have none of those symptoms. The BH&HPA have produced a comprehensive guidance on COVID-19 in the environment, and we have followed and taken into account your feedback on the draft consultation. We've looked at practical advice by each area of the operation of your park. And we have also produced three risk assessment templates, which are pre-populated. It's the intention that all of this information will make writing your procedures easier and also make it much easier to carry out your own risk assessment. Other guidance is available from external bodies such as the National Health Service, Public Health England, the BBC. This is just one example from the BBC, which is a poster trying to inform people how to avoid spreading the virus. Where there is guidance available in our own guidance, we have got links to all of those bodies. Now, I just have to remind you that risk assessment is a legal requirement. It's not additional, it's already enshrined in law, and it is this risk assessment, or all three, if they're relevant to your park, will need to sit alongside all your other risk assessments. So you need to assess what could cause harm, who might be harmed, and what can be done to eliminate or reduce the risk. So, just for redefinition, what is a hazard? A hazard is anything that might cause harm. Now, clearly in this example, it's going to be COVID-19 itself that will cause harm. What's the risk? So we want to know what's the likelihood that someone will be harmed, and also how serious that harm could be. Now, we clearly know it can go from somebody having no symptoms but to fatality. The hazards from coronavirus are twofold. There are more that have been suggested, but I think if we follow these two main hazards, then we will be in control, as far as we can be, of the virus. So the first hazard is that somebody who is carrying coronavirus coughs or sneezes on another person, infecting them directly through inhalation. So somebody coughs in your direction and you breathe it in, there's a chance that you will contract the virus. The second way is touching surfaces or objects contaminated with coronavirus and then putting or touching your face, particularly your nose and your mouth, with your contaminated fingers, and then breathing in the virus. To avoid passing on the virus by inhaling it, we can employ 4 main simple measures. So the controls we can have are contact with as few people as possible outside of your household. Social distancing has obviously been the main message from the government and is absolutely correct. So keeping a specified distance apart, at the moment that's 2 metres. There is a chance that that can change and is being looked at, but 2 metres apart is the recognised distance. But there is a caveat for that, is where it's reasonable to provide that in a workplace is government guidance. And that's because of this third factor. So the other thing that will look at the chances or increase the chances of inhaling the virus is the amount of time that you spend in contact with an infected person. In current government guidance, if you are in contact for less than 15 minutes, then you are unlikely to contract the virus. This means that actually you would be, if you pass somebody in a corridor or you're in a shop for a few minutes, it should be an acceptable level of risk. The fourth one is about ventilation, and the more ventilation, i.e. being outside or properly ventilating an internal area, the greater the rate of ventilation, then the less the chance of inhaling the virus. So hence in our guidance, for example, we have put in that the caravans should be ventilated between lets so that those going in to clean them are unlikely to be infected. So how to avoid spread by contact? Well, this is almost entirely reliant on good personal hygiene. So not touching your face, good extended hand washing of 20 seconds. Soap and water is perfectly fine. There are posters saying how you clean your hands properly. We have seen even on instruction videos, people just washing their hands briefly under running water. It needs to be done to a high standard, washing the backs of your hands, fronts of your hands, between your fingers and your fingernails in the palm. Cleaning and sanitizing frequently touched surfaces. So that is door handles, plates, etc. And no direct physical contact with others. This does mean outside your household. So of course you can hug family members that you live with. But for other people, it's not even advisable to shake hands. So I put together this just to explain how many ways the virus could be transmitted. Not to alarm, but we can break all of these chains of transmission if the above measures on hygiene and on inhalation are observed. So the virus could spread holidaymaker to holidaymaker, holidaymaker to team member to holidaymaker, team member to third parties, such as contractors, third parties to holidaymakers, team members to other team members, and vice versa. So you can see that it's easy to spread if it's not controlled. So who's at risk? Well, clearly team members working on and or living on your park. Contractors working on your park need to be considered in your risk assessment. Friends or family visiting park to see residents or private owners. Residents living on the park, or holidaymakers visiting their park. So where are the risks? You need to specify this in your risk assessment. We've pre-populated that with some of these areas, such as offices, buildings where people who do not live together could gather, staff of duty areas, staff accommodation, public places and spaces, and of course the accommodation that you offer on your park. We have put together 3 risk assessment templates for you. The first covers most of the reopening and operation of parks and will be applicable to all parks to a greater or lesser extent. The second risk assessment covers all areas of bars and dining, and the third one covers caravan sales. They are all also available, as well as Appendix 2 of the guidance. They are available on the risk assessment tool which is freely available to members of the BH&HPA on your member website, on your login. So as mentioned previously, a risk assessment is a legal requirement. So the 3 separate risk assessments we've done for COVID-19 will feed into something that is a scheme called COVID-19 Secure. Now this is online and can be completed by yourselves. The first point of this is that you have carried out a risk assessment and shared it with your staff for COVID-19. So I'll explain about the COVID-19 Secure document further on, but you will need to complete the risk assessments before you can confirm that the first steps have been taken. The 3 risk assessments we've just talked about are all on the active risk assessment tool on the BH&HPA website. Members can access the full system by logging in using their usual member number. The documents have also been put onto an open page at bhhpa.org.uk and are widely available for use. To give a simple demonstration of how the tool works, I've asked my colleague Paul of Prime Systems to demonstrate.
This is the risk assessment homepage that you come to after logging into the system through your members portal. You can click on the link Risk Assessments to open it up, but also remember there is a user guide over here on the right that you can download anytime to see more details about how to use the system. So click on Risk Assessments and then click on your park name. This then brings you to the list of suggested risk assessments that are available to you in the system. And you'll see the 3 new ones that have been added for the coronavirus risk assessments. This one here called Safe Park Reopening and Operation can be done by all parks, but if you have dining areas and bars, or if you have caravan sales areas, there are 2 further risk assessments for you to complete if you need to do so. To complete a risk assessment, you come over to the link here called New Risk Assessment and click it. You then just confirm that you want to carry on and do this. And when you do, it takes you into a new risk assessment. First of all, you can say when the risk assessment was done, and you can say who did it. First then, go to the Hazards and Risks tab. This outlines people who are involved in the risk assessment, what the hazards are, what the risks are, and who the people at risk are, and the locations on your park. You'll notice that most of the boxes have already got wording in there, and that's the default wording that's given to you through using the template. But feel free to change it, make sure it's specific and applicable to your park. You can also add details of the people involved in the risk assessment in the box here. When you've completed that section, click onto the Controls tab, and here you'll see a list of all the controls that are set out for you to answer by either clicking on yes, no, or not applicable for any controls that don't apply to you, and simply work through each one, clicking the appropriate response. If there's something you come across that you're not doing or you haven't got in place yet on your park, click no, and then over here on the right, you can click on the little icon and choose Add Action. This will bring up a screen in which you can record the details of the action that you need to take. Fill in all the details as shown here, including selecting a date in the future by which time this action should be completed by. You can also upload any files or photographs for more detail. When you've done that, click Save, and you'll see it writes it back to the risk assessment, and you can carry on. Just work through each control, answering either yes, no, or not applicable. And when you've finished that, come back up to the top and click the Submit button, which will take you back to your list of risk assessments, and you'll see here that the one you've just completed is showing as complete with today's date. Don't forget the user guide on the homepage to give you more information about how to use the system.
You've completed your risk assessment, so what do you need to do next? Well, the risk assessment should form the basis for your safe working procedures. So that will detail how you're going to put in place all the things that you need to. Now, this is just a very small snippet of one area of our guidance on team members' health and wellness. So in this particular example, we are advising that you should have somebody on park with a thorough knowledge of COVID-19 who can make informed decisions about the virus and check that measures are being implemented. So your procedures, your own personal procedures, would be who is going to adopt this role, what training they need to have to make them informed enough to make the decisions. In the second part of this little snippet, then we've got what we suggest you do in terms of communicating to team members. So you would have, without face-to-face contact where possible, through email or online meetings as your formal communication. So it would be specified in your procedures what you're going to do, how often you're going to have the meeting, and what format they will be in. So that should be completed for all areas of the guidance that are applicable to your park. So you've completed all your safe working procedures and your risk assessments. You would certainly want to declare that you are COVID-19 secure. Your customers will be looking for this, and it's something that if you have more than 50 employees, you need to declare on your website in this format. So you print this off and actually sign and date it, and you're confirming that you've carried out a COVID-19 risk assessment and that you've shared the results of this risk assessment with your team members. Secondly, you declare that you have cleaning, hand washing and hygiene procedures in place in line with current guidance. And that you've thirdly taken all reasonable steps to help people work from home. Well, this isn't so applicable to the holiday parks industry. Obviously, people need to be on park to work with customers and maintain your park. But it would demonstrate that you've considered people who cannot be working from your offices or work park. And that might be somebody who's shielding or physically not able to be at work because they're looking after somebody else. You also need to declare in the fourth one that you've done everything is reasonable to do to maintain a distance of 2 meters in the workplace. And the whole of your park is actually a workplace. And then there is a caveat to that where it's not possible to keep people 2 meters apart, say in a busy reception, then you've done everything you can to manage the transmission of risk. So that could be as simple as something like barriers between them, or employing people, the same people on the same shift, so you don't maximize the number of contacts. And so I would strongly suggest that you actually print off and display the COVID-19 secure poster. Thank you.